Today, the top 10 diseases account for the highest statistics of deaths. These include heart disease, stroke, diabetes, hypertension, and more. Many people with these diseases have poor blood flow. Buildup of fatty deposits causes plaque to form in the blood vessel, reducing blood flow or even completely blocking an artery over time. So how can we treat this condition? Current common treatments to help reinstate blood flow are invasive and have a long recovery process. With Renew ECP therapy, you now have an option that is safe, non-invasive, known, and trusted. Renew ECP therapy is a process that uses external counterpulsation to improve blood flow. External counterpulsation is a process of compressing your blood vessels to the rhythm of your heartbeat so that the blood flow back to your heart is enhanced. A patient lies on the treatment bed with 3 sets of cuffs secured on the lower body. 1 set on the calves, 1 set on the thighs, and 1 set on the hips. These cuffs are timed to inflate and deflate between each heartbeat. When the heart is at rest, the cuffs pump sequentially from the calves up to the hips. This compresses blood vessels, increasing blood flow back to the heart. Just before the heart pumps, all 3 sets of cuffs are deflated simultaneously. This rapid deflation of the cuffs reduces the amount of work required of the heart to pump oxygenated blood back to the rest of the body. This process repeats throughout a Renew ECP therapy session, and the patient can enjoy while watching television, listening to music, or simply relaxing on the treatment bed. Compared to surgery, medication, and other treatment methods, which have high risk and side effects, external counterpulsation has been proven to be safe and low risk. With this simple process, what does Renew ECP therapy do for you? When your blood flow is enhanced, it increases the flow of oxygen and nutrients to all parts of your body, including the major organs such as the heart, brain, kidneys, liver, and skin. This increases bodily as well as organ function. New blood vessels are also formed as alternative pathways for your blood to flow through. This is sometimes known as a natural bypass. In addition, blood vessels will dilate, allowing even more blood to flow through. Overall, vascular health is improved. Renew ECP therapy is a known and accepted treatment for chronic stable angina, which is a condition that results from the top disease, ischemic heart disease. However, numerous clinical studies have also been done for various other conditions. With regular Renew ECP therapy sessions, you can experience positive effects that can last for years. Patients have experienced sustained improvement in their overall quality of life. As one of the simplest and safest treatment methods, Renew ECP therapy could be beneficial for many people. Talk to your doctor and see if Renew ECP therapy is right for you.
My name is Louis Swartz. I'm 72 years old. I live in Los Angeles. I've had diabetes for 28 years. I've kept it under good control, but it is a degenerative disease. And I was experiencing in the legs, made it difficult to walk, reverse it or change it or really do something with it. And then I found out from someone at work about global cardio care. It made sense to me that there could be a great deal about a condition like diabetes that could be related to the circulation of blood in the body. The blood, being the thing that gives the nutrients to the various organs. And I immediately felt changes in the ability to walk, which was very valuable to me. And as I progressed with the program and did more and more of the therapy, I found that the perception was, that the pancreas, which is the organ that is affected by diabetes, was beginning to come alive. It wasn't an overnight thing, it was a gradual thing over time. I should also mention that part of the Saraswati Health for Life program is living on a plant-based diet fairly early in the program, and that's helped a lot. It's the only thing that I've come across that really has affected that condition. I consider that to be a result of the totality of the program, both the health aspects of it and the EECP. Since I've been doing the program, my ability to think and the keenness of my thinking, improved a lot. For example, amount of mental and physical ability.
Brain tissue to die due to blockages of the artery of the brain. EECP works while you simply lie down on a comfortable bed. 3 blood pressure cuffs are wrapped around your calves, thighs, and buttocks. When your heart is at rest, these cuffs pump oxygenated blood from your legs up to the heart. Due to the increased blood flow to the heart and the brain, EECP helps move blood through the arteries of the brain that is blocked and stimulates the growth of new arteries called collaterals. This increased blood flow enhances healing, improves structural integrity of tissues and blood vessels, and EECP improves direct motor functions such as walking, balance, speech, or vision. It's simple. EECP improves total cardiovascular function.
I felt better, stronger, and my eyesight has improved. We go to church, and we always sit at the back of the church, and the priest very clearly. But after my second treatment, I thought I changed my contact lens because I could see the face well defined. I could see, I could recognize the face of the priest. The key there is the blood flow. EECP really saved my life because I have already a death sentence from my doctor. He knew that I have 4 blocked arteries. He told me that I could be dead any day. 2.5 years later, when I started, I still didn't have a surgery, and I'm still alive. I'm still enjoying life with my grandkids, and I know that this will continue if I continue to stick with my new lifestyle. Like my sister-in-law had the same heart problem. She decided to take an open heart surgery. After 2 years, she had another surgery. To date, she had 6 surgeries. Yeah, I definitely, I would recommend Global Cardio Care. It saved my life, actually.
Does not pump blood throughout the body as well as it should. This means that your heart cannot deliver enough oxygenated blood or nourishment to your body and its organs. Heart failure often develops because you have or had a medical condition such as coronary artery disease, a heart attack, or high blood pressure, which has damaged or put extra workload on your heart. At first, your body will try to adapt and compensate for your weakened heart by working harder and faster, causing your heart to overwork. These adaptations only work for a limited time. In fact, in the long term, these adaptations can actually make your heart weaker and cause you to develop heart failure. This damage or extra workload can affect the pumping and filling of the heart muscle. EECP acts as a second heart, pumping blood upwards from the calves, thighs, and buttocks towards the heart when the heart is at rest. Oxygenated blood circulates through the coronary arteries to feed the heart muscle. This strengthens and rejuvenates the heart tissue. For the first time, EECP helps reduce the workload of the heart by increasing massive blood flow to the heart muscle while it is at rest. Clinical studies prove that EECP treatment decreases the workload of the heart and at the same time increases blood flow. This results in strengthening the heart muscle. EECP helps move blood around the body and delivers oxygenated blood and nourishment to all organs. With constant courses of EECP treatment, heart failure can be improved.
During EECP therapy, the patient lies on a treatment bed with large blood pressure-like cuffs wrapped around the patient's calves, thighs, and hips. EECP is timed to the patient's heartbeat. While the heart is at rest, the cuffs inflate in sequence from the calves to the thighs to the buttocks. Just before the next heartbeat, all the cuffs deflate simultaneously. For many patients, 35 one-hour treatments of EECP therapy results in decreasing their chest pain, fatigue, and shortness of breath. During inflation, blood flow increases to the vessels that supply the heart muscle. Oxygen-rich blood is increased by widening existing pathways, activating vessels, and developing new arteries called collateral vessels. Rapid deflation of the cuff's pressure assists with unloading the heart supply to the body. This action decreases the workload of the heart. The enhanced blood flow throughout the body strengthens the lining of the vessels by expanding pathways and reducing inflammation. EECP results in improved circulation and an overall healthier cardiovascular system.